Thank you, Shama, and thank you to everyone else for being here. I know that people are dealing with stresses of varying degrees in their lives right now, but I'm happy to have all of us together to chat about topics that are of interest to us individually and as a group. So I am going to try to reframe some of, so Shama provided a useful way to think about the broad themes of today. I want to put it in a slightly different way, but it's really the same thing cut up in a different manner. And then I'll move on to introducing the panelists. So one way to think about the role of economics and policy is to think about the different settings in which we will have to ask these questions. One is, what about policy during the crisis as a way to alleviate the crisis? Second, what about policy immediately post-crisis? In the sense that when the economy emerges after the public health crisis is over, what should we be thinking about there? And the third thing is, what about the big picture? Should we be rethinking the big picture of how our economies are organized and how we choose our micro and macroeconomic policies? So on the first couple of issues, like stuff that we have to think about during the crisis and after the crisis, I think one of the big things is the interplay between stimulus packages and worker welfare and worker diversity and inequality. So what I mean by that is that what's happening right now is amplifying a lot of existing inequalities. And there are open questions about whether the stimulus package is actually taking those things into account. So there are distinctions between the salaried and the non-salaried. There are gender-based distinctions where women might find a lot of household burdens combined with professional burdens having a very different impact than men would. There is particular concern for minorities and low-income households. In the last couple of days, for example, we have seen data coming out about the particularly devastating impacts on African-American households in urban areas across the country. So, and we know that a lot of low-income households are also going to be living in more densely packed areas, so their patterns of contagion might be different. And these are all things that should have us wondering if there might be more sensible ways to structure continuing stimulus packages. Another point I want to raise in this context is that economics also has a lot to say about purely social interactions and social networks. So stepping away from the economy itself for a second. For instance, we know now that COVID-19 has caused a lot of deaths all over the world, but there's still some uncertainty about the death rate. So we are not exactly sure about whether we are dealing with a very, very high death rate here or a very high contagion rate. And each of those will have a differential implication for our understanding of the negative externalities we are dealing with here. And again, that will feed into our conversation about the relationship between inequality, population density, and the necessary social distancing measures that should be put in place. So those are a couple of immediate issues I want to point out. And finally, on the big picture, I think what we have here is a crisis that is not caused by capitalism per se. I don't think that would be the starting point here, but it is indeed a very major test of the current economic systems and their ability to handle something like this. So I know that in many cases, we have seen expressions of great concern about the current administration's ability and willingness to involve the federal government in the efforts. And these are things that I think our panelists might have something to say on as well. So now let me move on to the panelists and give you a sense of how we are going to proceed. So our three panelists have very different approaches and very different specializations, and that is the appeal. And I think we are all going to really appreciate their expertise and their opinions as they speak. So I'm going to order the opening statements. These are going to be short opening statements by the three of them. I'm going to order them roughly from the local to the global. There isn't really going to be a clean structure to it, but that's the way that I'm thinking about it. And then we'll move on to a more open-ended conversation. So we're going to start. So I'm going to just tell you about the three panelists, and then we'll open with James Parrott. So James Parrott is the Director of Economic and Fiscal Policies at the New School Center for New York City Affairs. He is an expert on the New York City economy and the state economy, and he's worked on topics ranging from minimum wage to the economic impacts of 9/11. He is going to have a lot to say about New York City in particular and jobs in general. And he's also going to get us thinking about broad critiques of the federal response to the crisis. Then we are going to move on to Mark Levinson. He is the chief economist for SEIU, which is one of the most important American labor unions. He's also the book review editor at Dissent. Mark has worked extensively to refine and articulate many of the union's positions, including on healthcare and minimum wage. So he's going to start off by talking a little bit about the differential impacts of the crisis on different categories of workers. And he will help us think about what lessons we might be able to draw for policy going forward. And we're going to round out the opening statements with Sangeeta Pratap, who is my colleague in the economics department. So she is an associate professor at Hunter College and the CUNY Graduate Center. I miss hanging out with her, so we organized this panel so I could see a little more of her.
I do too.
So she is well known for her work on labor markets and firms. And she recently won the Banamex Prize, which recognizes the best research on Mexico. She's going to open with links to past crises. Is there stuff to be learned? What should we be reading into lessons that we've drawn in the past? And then she's also going to talk a little bit about broader questions of monetary and fiscal policy and what their roles might be right now. So that's the introduction. Let me turn it over to James Parrott.
Thank you, Karna. This is certainly the worst economic and broader crisis that we've seen in New York City since the 1930s. This is far worse than the impact after 9/11, the impact of the Great Recession of 2008, 2009, and the financial crash associated with that. And it's worse than Superstorm Sandy. In a sense, it's all of those rolled together, plus an unprecedented public health crisis. So there's a substantial economic impact that I want to talk about a little bit. Before I get to that, though, we do need to think about how this is an unprecedented economic crisis coupled with a severe public health impact. And as Karna discussed, it's affecting low-income communities and persons of color. It's now starting to become better appreciated, the effect that it's having on those communities that we didn't see before. And this raises far-reaching questions on what sort of policy responses are needed, both in the short run and in the long term. I think it's useful to think about three categories of workers here. Certainly, there are the frontline workers, the public health workers in hospitals and healthcare, and so on, together with the first responders and public service workers and other essential workers who are keeping the food supply chain operating and other essential public services. Then there's the category which is predominantly comprised of low-paid workers whose jobs were sacrificed in the interest of public health. These are the workers in leisure and hospitality, but also in the performing arts. You know, one of the first sectors that announced closings was Broadway. Museums were shortly after that. and a lot of movie production. So it's hit a lot of people in the arts sector as well as restaurants. In addition to that, a lot of the non-food parts of local retail and local service establishments, the transportation sector. Think about all of the taxi, Uber, and Lyft drivers who have seen the number of rides plummet by 75 to 80% in recent weeks. And finally, a lot of construction workers who are not able to work. By and large, these are workers who are paid by the hour. And when they're not working, they're not getting paid. The extent of these job displacements is really substantial in New York. I've been, revising my estimates as we go along on this. At this point, I would say it's 1 million to 1.5 million workers. That's 20 to 30% of all jobs in New York City. These different categories of workers have different concerns and needs, and the public response at the local level, as well as in terms of the federal economic response, needs to appreciate those differences. Fundamentally, we've encountered significant failures in government's response to this. One, in the healthcare system, first and foremost. I'm not an expert in that area, but we can all see how that's there's been massive failures there. But also, our state labor department and other labor departments around the country we're really not prepared for the onslaught of initial unemployment insurance claims. So it's great on the one hand that the federal government has authorized significant enhancements to unemployment insurance. On the other hand, a lot of workers have yet to be able to successfully file their claim. Once the public health crisis passes, we will be in a severe recession. Recession was bound to happen sooner or later. This crisis helped, trigger the onset of that, and it's critical that the economic assistance provided to workers and businesses be of a magnitude and certainty that allows businesses to decide to stay in business and not close their doors, so that there won't be jobs for those workers to come back to once the public health crisis passes. Undoubtedly, there will be some degree of fall off in the business community, and there will be some retrenchment related to the ongoing recession and credit problems and so on. So we need a public policy response commensurate with the severity of that issue. Let me talk briefly about the federal response in the CARES Act. This was the massive stimulus package, which is really the third round of response. It included recovery rebates for adults and children in families with incomes below $200,000. So that's important to get these checks out to people as soon as possible. I've mentioned the supplements to unemployment insurance. For the first time ever, there's been a $600 weekly unemployment insurance supplement, which is a positive way to respond. And for the first time, independent contractors who are not employees per se, so they traditionally haven't been covered by state unemployment insurance programs, are now eligible to receive unemployment assistance and the $600 payments. And finally, there's been various types of business assistance. The Small Business Administration has $350 billion for loans that under the right circumstances could be forgiven to help small businesses keep workers on their payroll, pay their rent, mortgages, utilities, and so on, and hopefully stay in business. And then, of course, there's a huge $500 billion pot of money for large company bailouts, and a lot of us are very skeptical about how that money is going to be used. Well, this is an unprecedented degree of federal response to an economic crisis. I don't think it's sufficient at this point, and mainly for two reasons. One is that most of these measures are very short term. What we need are commitments on the part of federal government that sufficient assistance will be provided for as long as the need exists. this is going to continue. The need will continue long past the public health crisis passes. We'll be in recession. A lot of people will be out of work. State and local governments, are seeing the beginnings of very significant revenue shortfalls. For them to keep providing essential public services, most government services in this country are provided at the state and local level. So it's important to keep those levels of government functioning. So we need, hopefully very soon, a clear commitment on the part of Washington to continue assistance on a scale that's necessary and continue that as long as needed. And finally, there needs to be recognition of the fact that a significant category of workers heavily impacted by the job shutdowns so far, undocumented workers, have been frozen out of all forms of economic assistance to date. So they're not eligible for the recovery rebates, they're not eligible for unemployment insurance, and so on. In New York City, approximately 15% of this 1 million to 1.5 million dislocated workers are undocumented workers. For public health reasons, we need these workers to be able to stay home, take care of their families, and not add further to the economic crisis.
Okay. Thank you very much, James, for several important issues that you raised. Let's move right on to Mark, who will take over from now.
Okay, I'd like to make just raise three points at the beginning that we can talk more about in the discussion. First, we have to understand why this crisis is different. This is not a normal recession. Secondly, I want to say a few words about the implications of this for our labor market policies and how different workers are affected. And third, why this may be a transformative moment in social and economic policy in the United States. So 3 quick points. First, why this is different. This is not a normal economic recession. This is not a downturn, caused by the Federal Reserve raising interest rates to slow the economy or imbalances in the economy that lead to a recession. This is the U.S. government purposefully, because of a public health emergency, shutting down the economy, which is going to put out of work millions of workers in a shorter period of time than we've ever seen. Quicker than during the Great Depression, quicker than during the crisis of 2008. We are talking about millions of workers. In the last 2 weeks, over 10 million workers applied for unemployment insurance, and that understates the extent of the unemployment problem. We are, there are projections that the unemployment rate could reach 15, 20, 30%. This is completely unprecedented in the lifetime of almost anyone, living today. So this, the cause of this is different, and it's going to require a different kind of response, first of all. Secondly, the impact on workers. First of all, one thing we have to recognize, the essential workers, one of the contradictions of United States, workforce policy, the essential workers who are keeping our society functioning today are often, shamefully, low-paid workers who are taking enormous risks, not with inadequate protections, and yet they are deemed essential workers, keeping our society functioning. And it's just shameful that we as a society, that these workers are not represented by unions, that their labor is not recognized for its worth, and don't provide these workers life-supporting jobs. And that kind of contradiction is just highlighted in this crisis. Third, and we can I want to talk about this more in the discussion, but because this crisis is so different, it requires a different kind of response. And even though as you know, James documented, the CARES Act, which was a large response, $2 trillion is not a small response. The total dollar amount of this is twice as big as the stimulus enacted by the Obama administration after the 2008 crisis, although a quarter of this is, you know, goes to big business, which probably needs it less. But the problem with it is the traditional modes of response. Unemployment insurance, for example, is not an adequate response to this kind of crisis. We need larger, more comprehensive, not individual responses, but more collective responses. For example, in many countries, in Britain, Ireland, Denmark, to some extent Germany, what they've done is to keep people employed. The government is paying businesses to keep workers on the payroll. And it would result in much less displacement if we did that here. It would allow those who have health insurance to keep their health insurance, and it'd be much easier to administrate, and it kind of keeps the society intact. We are now facing, you know, catastrophic job loss, massive bankruptcies. A much more efficient way to support millions of workers would be to allow them to continue their employment relationship. It would keep the businesses intact. And the government should be paying for that, backed by the Federal Reserve, which has the resources to do it. Anyway, that is an example of the transformative kind of policy we need now. Just one other thing. We need much more aid to the states. The states are going to be facing catastrophic budget crises. They are bound by law to balance their budgets at a time when their costs are escalating and their revenues are declining. So we will need a huge infusion of federal resources to the states. Again, the Federal Reserve can back those efforts. Thank you.
Thank you, Mark. I will circle back with questions for both you and James on some of the things you pointed out, but let's move on to Sangeeta now.
Thanks, Karna, and thanks everyone for being here. Students, hello. I miss you all. I just wanted you to know that. So I'm going to pick up right where Mark left off. And so I want to talk about two things. First, what can we, if anything, learn from other crises? And second, while both James and Mark have talked to a large extent about the fiscal response, Mark has also alluded to what the Federal Reserve can do. So I'd like to develop that a little bit. Now, as far as the first question goes, I think nobody in this room or indeed anywhere in the world is under any illusion that this is not unprecedented, unforeseen, amazing, you know, you name it. So what exactly in this new situation, what exactly can we learn from the past? So the first thing I want to say is that I want to be a little bit careful about comparisons with the Great Depression. The Great Depression was a 10-year period of a lot of misery. And one of the reasons that it lasted for 10 years was extremely bad economics and extremely bad policy. So one thing which I think we have learned is that raising taxes is a terrible idea, as Herbert Hoover did in 1931, I believe, and reducing liquidity is an even worse idea. And so I think what we can, on a positive note here, in a situation where there are few positive notes to be struck, what we can say is that we hope that we have the ability to be freer of, shall we say, poor policy than we have in the past. It's also true that previous recessions have always been, policy responses have always been geared to stimulating the economy. And right now, we want to do exactly the opposite of stimulating the economy. We want to keep us on life support, since medical metaphors are what spring most to mind right now. Nevertheless, there are some useful lessons about life support, especially from the 2009 recession, which originated in a financial crisis. And that was, for the United States at least, the first time that the Fed expanded its playbook beyond interest rate manipulations, and phrases like quantitative easing and troubled assets relief programs entered our collective vocabularies. And not surprisingly, these have been the first line of defense as far as monetary policy goes in the current crisis again. The Fed has committed again to buying a broad range of securities backed by mortgages, credit card loans, student debts, auto loans, commercial papers. And what I think is potentially a new and interesting program, again, picking up on something which Mark said, was the support which it is committing to the Small Business Association's payroll protection program through its Main Street Lending program. What is this? The idea is that this program is supposed to give up to 250% of monthly expenses based on payroll or debt repayment to companies with less than 500 employees. It also includes the self-employed, I believe. And now, as Mark mentioned, Germany has a similar program which has already seen over 500,000 applications. We have not seen that. In fact, our program seems to be so far a little bit glitchy. My current hope is that this is just like the early days of Obamacare, where the website crashed, and we're going to see something different in a while. The US has certainly been off to a messy start here. Now, why are these programs important? Well, we need to ensure the survival of firms. This is going to be a key element in any recovery scenario. Previous academic research, I'm thinking of work by Shigeru Fujita and Giuseppe Moscarini, which tells us that in normal recessions, in other recessions, the recall rate of employees is about 40%. In other words, not temporary layoffs, but 40% of people who've been unemployed during a recession go back to their old jobs. For people who have up to 3 years worth of experience, that recall rate is 60%. These are big numbers, and we want to bolster these numbers. I think that's important. Further, there is this other issue of what we call match-specific human capital. Workers build up expertise which is specific to firms, and the destruction of this relationship will mean that some of this expertise is destroyed. With my co-authors in previous studies, we found that in Mexico, for example, the destruction of this specific expertise could account for something like 40% of all output loss in a recession. So it's important it's very, very important to subsidize that. Now, of course, it's equally important to understand that lending money to firms with zero revenues cannot continue indefinitely. We've also already seen a massive increase in unemployment claims. So, the largest has been in California, the second largest in Pennsylvania in absolute terms. And this is where fiscal policy, as James has talked about, and Mark to some extent, is also going to play a very important role. Since there are many panelists here who are probably more well-versed in fiscal policy and its effects on inclusion and exclusion of vulnerable populations, I think I am just going to raise 2 points here. The first is that speed is of the essence here. We know that our unemployment insurances, our unemployment insurance programs are overburdened. People are talking about how, everyone has their favorite anecdote. Someone in Rhode Island was told to fax their information. People can't get through to the websites or the phone lines, which they need to. Speed is so these are extremely overburdened systems right now. We also know another very worrying statistic that about 40% of all people in the United States are what we call hand to mouth. What does that mean? Their net worth is less than 2 months of their income. So while these people are getting relief, whether it's from stimulus checks or from unemployment insurance or from Medicaid expansions, which will allow them to get health insurance, their rent, their utilities, and their grocery bills, they have 2 months worth of money for this. So what I would actually like to see is something like a complete moratorium on these payments, but understanding, of course, that someone's rent payment is somebody else's income. So these moratoriums on, shall we say, all freezes on rent, credit card payments, or student loans, what I'm essentially asking for, these to be de facto guaranteed by the Fed. In other words, what I think we're going to need is for the Federal Reserve to function as a lender of last resort to the United States of America, to every company in the United States of America. That's one thing which I think is important. The second thing which I want to bring up is the redeployment of resources. We also know, just as we are concerned about preserving employment, preserving relationships, we're also concerned about redeploying resources to more effective areas. For example, at the moment, we cannot expect the price mechanism to do this. Why? Because the price mechanism is not going to be able to internalize the social benefits from deploying resources in particular ways. The price mechanism also privileges people who have the ability to pay. And as the other panelists and many other people recognize, this crisis has hit the people who are the most vulnerable, the most. So the second type of measures which I want to think about are how do we deploy resources? How do we get pilots from United Airlines to be flying their planes for FedEx? How do we get bus drivers from Trailways companies adding to, say, UPS? How do we think about protecting the supply chain? In other words, how do we move workers from sectors which currently have low demand to sectors which have extremely high demand? While unemployment and payroll policies and payroll protection policies are extremely important, I think my second big point would be, the Defense Production Act, which has currently just been deployed for health-related issues. I think it might need to be deployed for a much broader range of issues, with greater attention being paid to the supply chain. I think I'll stop here now and wait for other questions.
Thank you very much, Sangeeta. So let's do the following. I'd like to start off with a broad question, which I'm going to set up in a way that will hopefully also allow the three of you to respond to some of your differences of opinion here. And then I think Shama would like to speak as well, and then we will open it up to the audience. So let's keep our responses fairly short, but they can be open-ended and we can go in whatever directions people find interesting. So from me, something that has emerged from the three of you is that we've got to think in new ways about worker protections. And that's because the job losses have been unprecedented. That combined with the fact that a lot of people were hand to mouth already means that the effects could be devastating. And this brings us into an area where there is room for a lot of genuine disagreement. And I think we saw some of this disagreement here already about within the world of fiscal policy, how do we think about what to do? So a few things I'd like to throw out here are the following. So if we are thinking about the protection of workers who are either working today or might have lost work today, when we think about fiscal policy, there's two things I would like to bring up. One is stimulus payments. To what extent should this issue of speed be the dominant issue, and to what extent should that be linked to whether or not we should be focusing on targeting? And if we should be focusing on targeting, how should we do the targeting? Secondly, if there's a lot of people losing work, should we have a new conversation about universal basic income? How about thinking about worker protections in a way that is more delinked from the labor that they provide? And related to that, why not raise taxes in order to have a universal basic income? And then relatedly, what about non-fiscal responses? Two things that strike me as being particularly important in the current scenario are: what is the role of unions going forward to provide protections? And what is the role of labor laws and unsafe work condition restrictions and so on going forward? So that's just what I wanted to throw out to the three of you. And if you feel like responding to anything that I've raised, that would be great. But I would also be happy to have you use this as a framework to speak to each other. So maybe because we can't see each other, let's go with the same order that we started with. So maybe stick to James, then Mark, then Sangeeta.
Okay, you certainly opened a lot of ground there, so there's a lot that we could talk about. Let me touch upon a couple of things there. One of the things this crisis has really exposed is the precarious nature of precarious work in the United States. The broad population has seen just how fragile the economic lives of independent contractors and workers in the gig economy and a lot of low-wage workers who are living hand-to-mouth, paycheck to paycheck. Fundamentally, I think this is important both in terms of how we direct immediate economic relief, and I think the priority has to be on assisting those workers who have the fewest economic resources to fend for themselves in this. And these are workers whose jobs largely have been sacrificed in the interest of public health, understandably so, but also that carries with it, a real government obligation to provide for the economic sustenance of those workers. So that should be the priority. And the longer term dimension of that is that I think that the priority should be on improving the quality of jobs before talking about a universal basic income, because part of the reason why there's a need for universal basic income is because we so unfairly and inadequately compensate many millions of workers in this economy. So we should start by rectifying that situation. There are a lot of other aspects to the labor picture here. A lot of it also comes down to the fact that we've seen, in very disturbing ways, how we don't really have a government that functions at any level, and we don't have a healthcare system that really functions to serve, what its intended purpose is. So we need to think about that, and I think labor unions can play an effective role in that, because they're the only way that we know of in this society to provide workers with a true voice. So I think we need to have a broad discussion about what sort of government we need to have, what sort of healthcare system we have, and how we restructure work and the rewards to work.
Just a few quick points. First, um, we should distinguish what we need now is not stimulus. What we need now is relief. Remember, the government purposefully has thrown out of work millions of people in a very short time. It's going to last for we don't know how long yet. What is required is massive relief, both to businesses and individuals. The most efficient way to do that would be to keep people in their jobs, keep businesses alive, and have essentially socialize the employment relationship, backed by the Federal Reserve. Secondly, on labor law, U.S. labor law is an international disgrace. U.S. workers do not have the effective right to organize unions, and that explains the low pay, inexcusably low pay of absolutely essential U.S. workers. That is something that has to be addressed after this crisis. This in the last 2 weeks, 3.5 million workers have lost their health insurance. If that doesn't demonstrate the need for a universal healthcare program, I don't know what does. 3.5 million workers have lost their health insurance in the last 2 weeks. This is going to be a crisis that should have been addressed decades ago, and that is going to have to be addressed as a consequence of this crisis. And so really what this crisis is exposing is really 40 years of what we can call neoliberal economic policy, which has gutted the public sector, reduced our ability to respond to this kind of crisis, and weakened social protections. All of those things are going to have to be addressed as a result of this crisis.
Sangeeta?
Okay, so I think there are a couple of things which I want to highlight. One of the things which I've been struck by is that how our response has to involve so many agencies. Unemployment insurance. Well, what about health insurance? Which states have expanded Medicaid? Which states can use, I believe, I forgot what the law is called. My health economist friends told me about, the 1115 waivers to extend health insurance, and how at each link of this chain there are frictions. So that's one thing which has struck me, that our need for speed and our need for targeting are working against each other. And while I don't know whether the US ever had, shall we say, protections for health insurance or other protections which were, ever comparable with European countries and elsewhere. What I find myself more and more drawn towards is extremely broad-based policies. So you mentioned universal basic income, Karna. That's a policy which I find very interesting because analytically, while on the face of it, it is as if it's a policy which doesn't discriminate between rich and poor. Actually, if one thinks about it for a moment, this is a policy which is equivalent to a negative income tax. So if there are, I don't know, this is something which I have learned, just a shout out to my PhD student, Nana, who's in the audience, who is working on universal basic income. And this is something I have learned from Nana. So if you and I are two people in the economy and you make 0 and I make 100, and the government guarantees each of us $10, well, and they tax me $20, well, I'm paying a 20% income tax, you're paying a negative 10% income tax. So this is this has the potential of being a very progressive policy. I see myself very much drawn towards these measures for their speed and their simplicity, and the fact that they reduce the administrative burden. right now. And right now we are all collapsing under an administrative burden. I think there will be time later, and I very much hope there will be time to talk about policies such as universal health care. It's certainly something which we feel is very important, as well as other worker protections. But right now, I think it's no accident that countries like Spain are indeed talking about universal basic income. We know that the incentive effects of these policies, at least to the extent we've seen them, are quite negligible. There's no reason to fear that workers will reduce their labor supply. There's relatively little reason to fear this will reduce private savings. So I think I would like to make a push for both simplicity and universality here.
Thank you. Shama?
Karna, thank you, and thank you to the panelists. From your comments, it seems very much the notion of frayed safety nets, social nets, as well as the nature of jobs that has caused this kind of inequality to make itself very apparent. All of you made the point that the devastation that the American economy and elsewhere that we are facing is not sudden. This has obviously been a chronic and persistent theme of the kind of growth that we have had in the United States. I want to think with you a little bit more about the nature of the economy itself. Some of you have raised the point that even as we come out of this pandemic and we are thinking about growth and restructuring, are we at the point where we can offer suggestions to transform the kind of work, the nature of work, from the gig economy, contractual labor that typically comes with great amount of precarity, as well as very little worker protections? Can we actually come to that point where we are making valuable contributions to a more shared economy? Maybe this is a point also where the United States might be in a position to play a leadership role to consider more green elements. Of course, AOC has been widely publicized in talking about the Green New Deal. Are we there to talk about that? Is this a moment where we can reflect on what it took to get out of the Great Depression with the WPA that Roosevelt led at that particular moment in time? So I just want to stop there and ask the panelists before we turn to the other to the audience here to think about what the nature of economy that you are actually envisioning as we restructure coming out of this. James.
Okay, I'll go first. So this economic crisis hit, this economic and public health crisis hit at the time when, we benefited from very low unemployment for a sustained period of time. And in New York State, we've also benefited from the phasing in of a tremendous increase in the minimum wage, where it had basically doubled from the federal $7.25 an hour in 2013 to $15 an hour in New York City, soon to be that in the suburbs, later on in parts of upstate New York. A lot of economic progress had been achieved for low-income populations in New York City. And this crisis, among other things, jeopardizes that economic progress that we had made. So it's really essential that we understand how to get the economy going again as soon as possible, as soon as the public health crisis passes. I think what Mark's been talking about in terms of, far better than doling out, to supplementing unemployment insurance and administering loans to businesses and so on, the federal government should have made a commitment, as was made in some European countries, to just have the federal government subsidize jobs and businesses for the duration of the economic crisis. It might not be too late to raise that idea. We know there's a fourth round of stimulus being discussed in Washington. It's my hope that there's prompt action taken on that before the end of the month. So I don't know if that sort of commitment can be made by that point, but I think the nature of this crisis and the way it's unfolding is forcing an accelerated consideration of ideas like that. So I think that's the most important thing to grapple with, is how to get people back working. And then I think it's very appropriate for us to be able to step back and think about the kind of economy and the kind of government that we need in this country. So this crisis has really exposed, a lot of, serious weaknesses in the current system. So hopefully it will be the occasion for a healthy dialogue on that. One thing that we can't overlook, and I think that's, the real concern for this is highlighted today by the fact that a primary election is going forward in Wisconsin under these circumstances, which is just mind-boggling. We have to not lose sight of the fact that protecting our democracy and making sure that we have an effective, full participant election in November is also an incredibly high priority for us to have a good economy and good public policy going forward.
Look, the nature of this moment, I think, was captured the other day by an editorial in the Financial Times, which is the paper really of international business. And they said, this is the Financial Times, and quote from the editorial: "Radical reforms reversing the prevailing policy direction of the last 4 decades will need to be put on the table. Governments will have to accept a more active role in the economy. They must see public services as investments rather than liabilities, and look for ways to make labor markets less insecure. Redistribution will again have to be on the agenda. Policies until recently considered eccentric, such as basic income and wealth taxes, will have to be in the mix." That is just an indication of the kind of rethinking that this crisis is leading to. Just one other thought on what Shama said. Ideas like the Green New Deal, and even beyond that, modern day equivalents of what Franklin Delano Roosevelt did. For example, we need a civilian conservation corps for care work. So it's not just, we don't need government just to, be building infrastructure, roads, bridges, parks, sewer systems, water systems. We need all of that. But we also need government to be ensuring care work, home care, elderly care, child care should be a modern day equivalent of the kind of public jobs programs that were instituted in the 30s.
Thank you, Sangeeta. Very quickly.
Very quickly, I think it's important to remember that you should never let a crisis go to waste. And I think the defining features of the past, or what we came out of the previous crisis, at any rate, was a huge disdain for expert opinion and a further retreat of the government from public space. I think we are suffering the consequences of both of these things. And so, yes, I certainly think that when I look at sort of this somewhat appalling patchwork of ad hoc measures, which is all that we seem to have to offer in terms of social policy, I certainly think that things like universal healthcare, perhaps issues which Mark has been talking about support for jobs, for care jobs, for all kinds of things where we thought that the market should be regulating these things. I think we will probably need to rethink a lot of this in terms of the government playing a much more important role in these matters. Finally, one more thing to say is that there is this question of how we're going to pay for all of this. There are 2 ways to pay for this. One is through taxes and one is through borrowing. My hope is that whichever way we choose to pay for it will be such that it works in the interests of of equity and fairness.
Sangeeta, thank you. First and foremost, big shout out to all our faculty who are on the call. I see plenty of folks and experts on universal basic income and many of the other topics that we have discussed today. I want to turn to Howard Chernick to ask his question, please.
Show Howard's video. I haven't seen him in so long.
Okay, can you hear me?
Yes. Hi, Howard.
Oh, good. So thanks, everyone. Interesting remarks. I've been thinking about the kind of fiscal policies towards state and local governments that we might consider. And I'm actually writing a piece on what is Nancy Pelosi floated the idea of undoing the cap on the deductibility of state and local taxes. And I saw a lot of comment from the people who are always on Twitter saying it's the worst idea I've ever seen, et cetera, et cetera. But I think there's a strong case for this. First of all, the way to think about it is that this would be I'm just going to give a little spiel and then I'd like to get a reaction on sort of new ideas. A way to think about this is that this is providing a price subsidy to state and local governments, and that's the most efficient grant type. It stimulates the most per dollar of cost. And we can think of it as analogous to the additional price subsidy for Medicaid under the enhanced matching rate that was passed for 6 months as part of the earlier bill. The second thing is everyone says, well, gee, this would just benefit a few rich people in New York. The point is that states react to this. States are not static. And in the 2008 recession, states with income taxes, many of them raised their income taxes and helped to minimize the cost to the economic downturn to states, whereas other states raised their sales tax or did nothing, and I think contributed to macroeconomic distress. So now obviously this benefits New York, which I think is only just given the huge political imbalance that pushed this cap through. But anyway, this is a small idea in numbers, in dollar amounts, compared to the huge themes that all of you have been discussing. But nonetheless, I think I got some encouragement when Nancy Pelosi sort of floated a trial balloon on this. And so any reactions would be great.
I'd like to give a quick reaction to that. I shared Howard's view up until recently when I was asked to think about this a little bit more. And I think at this point, given that there's already been a pretty significant cap put on that, I think to undo that just provides a huge windfall to people who don't need it. And it would be far better, for the federal government to do more and expect state and local governments to do less, relatively speaking. And B, I think there are various ways that New York can generate more revenue. I look to the corporate income tax, which has declined to a fraction of what it used to be in terms of the support provided by corporate and business taxes to New York state government. So I think we should first look there. That's a way to indirectly tax the people who own all those equities, which will put the burden where it belongs.
Look, I would just say, compared to what needs to be done immediately, this would not be, on the top of my list. I mean, over the last several decades, when we've devolved policy from the federal government to the states, it makes sense, to do what you're doing. But as a response to the crisis, as you said, it's kind of a small idea. And so in that sense, it's kind of a distraction from what, really, needs to be done. And in this time, and so there's just so much more stuff that has to, happen, and to kind of sell this as a meaningful response to the crisis is just, inadequate, I think. Now, is it smart tax policy? That's kind of a separate, debate from what needs to be done, in the next several weeks in response to this crisis. And so, in terms of what needs to be done in response to this crisis, that would be, fairly low on my list.
Thank you, Sangeeta. 1 minute response, please.
I think I don't have anything to add. Usually,
Great.
Howard is my go-to guy for these kind of questions.
If I could turn to Partha Dev from Hunter Economics, please.
Hi, do you guys hear me? Have I
Yes.
myself?
Go ahead.
Okay, great. So I want us to sort of step back just a little bit, because I think one of the things that's possibly getting lost in the conversation that we find ourselves in the time of crisis is whether or not this crisis in part could have been averted, right? So kind of as an economist, I ask myself, was this an exogenous shock? Was this a meteor that just fell on us? And once every 100 years, if a meteor falls, I doubt we have the capacity to figure it out while it's falling on our heads. But if this was not a meteor, if this was a shock that could have been softened, eliminated because of public health policy, by public health policy, by economic policy, not the US, but in fact global, then perhaps we don't want to lose sight of that. Because my fear is that when we get to the other side of this and people are back in their jobs and there'll be a few years of conversation, and whether or not, so I'm a health economist, so conversations of universal healthcare are always sort of up. But for example, I doubt that universal healthcare would be doing that much on the margin right now. When you're in the ER and you're dying, then one way or the other, it matters not too much. And the question is kind of, could this meteor fall have been averted had we had better policy, bigger picture? Is it worth even thinking about? Is it something we can make it, from once every 100 years to once every 200 years that we have something this big and this bad fall on our heads?
Sangeeta, any response?
Yes, I think I would probably repeat something which I'd said before, that the past decade has been characterized by a great disdain for expert knowledge, and I think many of us would agree that the public health aspect of this crisis has been mismanaged very, very poorly, right from the availability of supplies, for protective gear for health workers, to information, to tracking responses, and so on. So Partha, I don't know, I think I might push back a little bit at the idea of that a universal healthcare system was not important. I will say that one thing which a single payer or a single organizer healthcare system perhaps could have helped with was more efficient transmission of knowledge, better tracking, more centralized databases. I have a small incident to share from when I was a student at Cambridge University. I happened to be at a party where an individual 2 weeks later was diagnosed with meningitis. I got a letter in my mailbox telling me where to go, where to get preventive medication, where to get tested. And the reason this could happen was that that person and I were all part of one system. So I think that any part of a recovery response has to talk very clearly about what we can do to prevent this from happening again. As I understand it, these viruses, these super viruses, are only going to get more common, not less. And indeed, the past few years have shown that. So, yeah, I think my broad thrust would be to agree with you, but also to appreciate how important the ease of sharing information is in this situation.
Sangeeta, thank you. We have about 7 minutes left, and I want to make sure we get a few more questions. I want to turn to Randy Filer, please.
Can you hear me now?
Yes.
Yes.
Okay. I probably will be the minority opinion here, as my colleagues are well known. Milton Friedman once said, "There's nothing as permanent as a temporary government program." And I think we really need to remind ourselves that we are facing a situation, whether it's as big a crisis as the doomsayers say, I have my doubts. But it is a time for responding to that situation, not using it as a stealth mechanism for other public policy things that need to be debated in and of themselves. So in defense of the American healthcare system in the crisis, I'll just point out one irrefutable fact. The US has about 30 ICU beds per 100,000 residents. Every European country with universal health care has fewer than 8 ICU beds per 100,000 residents. And I, for one, am going to be very glad to have those extra 22 beds if I need them.
Mark, if you want to reply.
Well, I don't know about the ICU beds per 1,000. I do believe and this in part really addresses the earlier question, the US response to this crisis has been shameful. There are there will be thousands of needless deaths because the current administration did not take this seriously when experts knew what was coming. And that is, simply, inexcusable. And so, the scale of this was not inevitable. We should ensure that never happens again. And it's also highlighting, many inadequacies, in our policies and our system. The fact that, this economy, the wealthiest economy in the world, can't supply basic protective materials. And, this calls into question a whole kind of model of globalization that, we're going to have to, deal with. So, yeah, there are some strengths to the U.S. system, and there are some massive problems and holes in it too.
We might have an impressive aspect to our healthcare system, but we don't really have the kind of smart public healthcare system that we need in this country. Or, we have a very fragmented public-private system with no overall coordination. The fact that we could not produce sufficient tests in this country that were clearly needed and demonstrated by the response in other countries is, I think that's the clearest indication of the failure, not only of the federal government, but of the healthcare system in the United States.
And in one sentence,
Yeah.
in one sentence, Randy, remember that we would much rather like to keep you away from those 20 ICU beds. I don't know if the United States can help us ensure that. So remember, that's what we really care about.
Sangeeta, thank you. We're going to take 2 final questions, please. And I thank you for your patience. Matthew Locastro and then Emmanuel Zabeda.
Hi, can you hear me?
Yes.
Hi, everybody. Matt LaCastro here, former public policy student of Shamas. So I think this kind of question falls in nicely with a little bit of what Randall was saying, and kind of goes to the point of Mark, the Financial Times article you mentioned, and Sangeeta's quote of, that taking advantage of a crisis, don't let it go to waste. I would want to question that idea of taking advantage of the crisis and how promising, this is as a point of inflective change to push forward these progressive policies in labor and healthcare and education. Being in quarantine myself, the amount of conservative media that I've been exposed to from my conservative-oriented family has increased, and conservative pundits are promoting kind of the same based argument, but with a different package message of it should be, anti-immigration, or that tax cuts are a better solution to put, money back into the pockets of hardworking Americans. So how do we, come up with that winning strategy of, actually taking advantage of the crisis for these policies we want to see be implemented in the age of Trump, where things have kind of topsy-turvy, and perhaps this necessarily isn't going to make that fundamental change we want to see?
James, I wonder if you might take that, especially from the vantage point of New York City, please.
So I think, there are obviously many ways to possibly respond to that. I think people are really looking for effective government. I'm not sure that we've seen the most effective response from New York City government. The governor has perhaps been better in some respects, although on the other hand, the governor was also responsible for the fact that the Labor Department was not prepared for an onslaught of unemployment insurance claims. The Labor Department was relying on a mainframe computer system to process unemployment insurance claims until about a year ago. The governor's been in office for 10 years, ample time to address that situation. People really need effective government to respond at all levels. We're not getting the response we need from the federal level, with the exception of what Congress has been able to push through. So, I put my faith both in local and state government and in that part of Congress that has the vision to respond in the way that we need.
Thank you. We're going to turn to Emmanuel very quickly, please.
Sorry, what are we doing, Shama?
We're waiting for Emmanuel's mic to turn on, please.
Thank you. Can you hear me now?
Yes.
So I want to thank you all, because I think we've had ignore my dog. We've had a fairly interesting overview of what macro changes to the way our economy functions we should explore. My question precedes that. So talk of democracy and effective execution of public policy requires think tanks and universities from which those think tanks derive their intellectual stock, especially in a political age of shameless nepotism, corruption, and conspiracy. My question is, how do you anticipate institutions of higher learning will be affected by COVID-19 and the economic crisis, and what does this mean for their funding, their work and purpose?
Emmanuel, if I could actually answer that, even as we speak, we are putting together a syllabus that will examine in an interdisciplinary manner, perspectives of this pandemic and the implications for public policy. So, the kinds of courses, and I know Hunter is not the only institution which is doing this. Across the country, departments are putting together learnings and lessons and model and statistical implications for what we are learning. So that's at one level. I think institutions of higher learning have to put together robust online platforms. Certainly the technology piece is going to be critical. Questions of equity and access have come up over and over again around digital divides and who gets to learn. If you look at the New York Times article yesterday, it said something like 40% of school students across the country who are expected to be online are actually offline. So no real learning is taking place, and that typically breaks down around on race and class lines, and geography as well. So I think we'll be looking at that. So I want to actually just turn to the panelists here to have final 30 seconds, no more, we're completely out of time, to talk about the one policy recommendation that you want to step forward, please, as a takeaway from this panel. But really 30 seconds, please, and I'm going to start with James Parrott.
I would say that one of the things that we haven't really talked about is, and hopefully this will be addressed in the fourth stimulus response from Washington, there need to be protections for public health workers, healthcare emergency workers. we need to provide them the health and safety protections, and we need to provide them with hazard pay. That should be at the top of the agenda.
Thank you. Mark?
Just two things. One, we haven't even talked about the international dimensions of this crisis, which are vast, and just to put that on the table. And secondly, the importance of the public sector stabilizing a very unstable situation. It was supportive business and workers, and to hopefully value now the workers who are keeping us afloat in this time.
Mark, thank you. Sangeeta, 30 seconds.
First, I think I would talk about safeguarding and strengthening democracy. I'm worried that for many countries, we're already seeing a hardening of tendencies which were already present, whether we're talking about Hungary or Brazil. So I would say everything that we can do to safeguard and strengthen that. And two, I'd like us to think about more universal mechanisms of social protection, both in terms of healthcare and income support.
Sangeeta, thank you. Karna, final 30 seconds in terms of either research agenda or even a policy reform. With your mic on. Mike.
I don't have all that much to add. Two things that I would just like to reiterate. I think one is the international aspect, as Mark pointed out. I think that is very central. We've got to think about ourselves in the context of the global economy and a global supply chain. And we've got to think about our responsibility to the rest of the world, and something that we haven't really talked about. And the other thing would be just a closing response to Randy Filer, which is that situations are often the best times to get those so-called temporary but actually permanent policies that we want enacted. So I would actually agree with him that that's a good way to do things. It's just that there might be a difference of opinion, as we've seen even here, of what those things are.
Karna, thank you very much. I want to take this time to thank James Parrott, Mark Levinson, Sangeeta Pratap, and my colleague Karna Basu for their help with this panel discussion. I know there were many more questions that were coming our way in the Q&A function at the bottom of your screen. I hope very much we might be able to actually save those questions for a future research agenda and certainly for more discussion. So thank you all. Thank you to our attendees who were representing from across the world, from India, from London, and elsewhere in the country. So thank you very much, and hope to see you soon. Thank you.
Thank you.
Thank you.
Very much.